Hi, so I am here with Nicola Clague-Baker. I'm not sure how do you pronounce your name, Nicola?
Clague-Baker.
Clague-Baker, and with Karen Leslie. And there are two physiotherapists, or as we would say in the United States, physical therapists. And along with two colleagues, they've just written a book about physiotherapy for ME. A physiotherapist guide to managing and treating and
Understanding and managing.
understanding the management of MECFS. And so, anyway, why don't you both sort of introduce yourselves and how long you've been a physiotherapist for? And then, really, the first question would be after that, why did you decide this was a book that you needed to write? So, Nicola, why don't you go?
Yeah. So I'm Nikki, and I have been a physio for over 35 years now. And presently I teach at the University of Liverpool, and half my time is teaching, half my time is research. And that's my background.
Okay. And Karen?
Yeah, so I'm a neurological physiotherapist, so specialise in disorders of the brain, spinal cord, nervous system. And prior to that, I was trained in journalism and did a bit of work in there in communications.
Okay.
So kind of a dual skill set that came into this. And me and Nikki met in 2019 alongside our colleagues Dr. Michelle Bull and Natalie Hilliard, and that's when we formed Physios for ME, which is a special interest group. Our aims are to educate physiotherapists about ME, and also to research new ways for physios to assess and manage ME patients.
And why did you feel at that time that was, and let's point out that was pre-COVID, so it was before the pandemic started, but why did you feel that was necessary at that time to form a group like that?
Well, I think at the time in the UK, the NICE guidelines, I was going to say what NICE stood for, but I forgot.
National
The
Institute
clinical
for
guidelines.
Health and Care Excellence.
That's the one. They were under review in the UK, and in 2019, they still said that graded exercise therapy was the main course of treatment for people with ME.
And
as
cognitive
physiotherapists,
behavior therapy too.
yes, yeah. So from a physio's head, our point we'd look at the exercise side of things, and I think it was just we formed naturally. We all kind of bumped into each other online. We started to talk and discuss about how this just isn't appropriate. So I think it was just I don't know if the timing was right or not, but it was a bit of a coincidence. We all happened to form in 2019, and thankfully then we're able to be stakeholders in that guideline process, and they got rewritten eventually. But in the meantime, our work just began to snowball and snowball, didn't it, Nikki?
Yeah, I would just add that all of us have had personal experience of supporting people with ME.
Right.
And
I was going to ask, like, what drew you to this understanding that standard approaches were not appropriate?
Yeah. So, I mean, from my experience, I have a very close friend that I've known since we were both 3 years old, and she developed ME when she was at university, and that was 30 odd years ago. And yeah, she tries everything, and one of the things she tried was graded exercise therapy, and it made her worse. And luckily, she stopped before it made her really bad. And really, at the time. She tried it. I had gone on a course about graded exercise therapy and fatigue management, and that was what we were being taught. So it really threw me in terms of how is this not right, because this is what we're being taught. And then looking at the research and looking at information online, I was blown away by how we were being taught one thing, and yet the research was saying something completely different. And as Karen said, we all got together online and we're all going, this is crazy. What we're being taught is absolutely the wrong thing, and we need to change this.
And so basically, as one of the things in the book that you focus a lot on, obviously, and I would guess that probably one of the big mismanagement strategies was not recognizing the existence of the phenomenon of post-exertional malaise.
Mm.
That's sort of, partly what you were sort of focusing on is what people were doing wrong.
Mm.
Yeah, and I think for us, it was identifying that is key for a physiotherapist. We're trained to ask people about their conditions, and we're looking for conditions that might change how we would treat them. Mm-hmm. So, osteoporosis might mean then you're not going to do a vigorous manual therapy on them because you might damage them. And to us, identifying someone has ME, and particularly post-exertional malaise, which is even more relevant in this kind of long COVID world as well, that should be playing on all physiotherapists' minds, whether you're working with someone with ME or long COVID or for some other problem. You need to be aware that this exists, because most of our interventions is likely to cause this phenomenon and probably exacerbate symptoms, give people new symptoms, potentially make them very much worse.
How have you found talking to other physiotherapists? Because, I would guess from your position, and I think to most people, it's kind of counterintuitive that exercise could be bad for people, be harmful.
Yeah.
And so how do you get over with your colleagues that hump, that basic counterintuitive thing about exercise?
That's been really, really difficult. And when we first started before the pandemic, we did have a lot of resistance from physiotherapists in the UK. And we felt we were the only voices saying this and having to repeat ourselves over and over again. But I think since the pandemic and since so many therapists have come down with long COVID, it shouldn't be the fact that you have to experience it yourself before you actually believe it. But it does seem to be the case that suddenly there's a very big number of physios and allied health professionals that suddenly actually realize what this is all about, and that it is serious, and it isn't anything to do with anxiety or depression. And it is a definite physical problem that you can't exercise out of. And it's been a lot easier to have those conversations since the pandemic. So, would you say, Karen? Yeah.
Yeah, and I think a big issue has been, because originally it's kind of seen as fatigue. A lot of conditions that produce fatigue respond very well to exercise. In my world in neurology, I work with people with multiple sclerosis, for example, or post-stroke fatigue, and they can all exercise, and often that will improve their fatigue. So it was trying to steer people away from this sort of concept of, well, it works for everyone else, and this is just another form of fatigue. It's chronic fatigue. And realizing that it's a very different process. This is something you'll never have treated before and worked with before, and it will respond very differently. But yeah, that was a big message to try and get through, because so many people have been relying on probably their own clinical experience, but also the research historically of which has confused chronic fatigue produced by anything, with ME. So there's definitely hurdles still there.
I think people working in this area understand that the word fatigue is really a misnomer to a certain extent in this context, especially if you talk about it to the exclusion of post-exertional malaise. So what did you feel the need then to write a book? When did that idea come about?
Well, it was actually a publisher actually approached us. We'd been operating online mostly, and they had seen some of the work that we'd done, and basically came to us and said, well, do you think, would you do a book? And we were like, yeah, all right, we'll have a go at that then. I think it was probably a big project, and one we hadn't expected to do quite this quickly, but the opportunity presented itself. And from a communication point of view, we were very present online, but there was this huge cohort of professionals that we probably weren't hitting. So a book is another way of getting this information across.
Mm-hmm.
So the opportunity was there and we took it, and you know, it's been a couple of years of work, but I think we're really pleased with the fact we've got it out. It's globally published, and it's another way of spreading some awareness and education.
Yeah.
I'm sorry, Nikki, did you want to say something?
No, I would say I think the publisher became aware of it because of long COVID, and you know, again, it's a horrible thing to say, but there is a positive that has come out of long COVID in the sense that people are more aware and are wanting to learn more about ME. And so that sort of opened a lot of doors for us, definitely. And yeah, we were really keen to do it. Karen in particular, with her journalism background, she just has the ability just to flow with words. It's very good.
How do you explain? I mean, so in the book also, well, actually, how do you two see the overlap between long COVID and ME/CFS? I mean, obviously, I think you make the point in the book that long COVID is a much broader term. ME/CFS has more specific things, and long COVID is just anybody who has symptoms about something after having a bout of COVID-19. So, you know, there may be people with post-exertional malaise, but other people with long COVID typologies, I guess, you know, don't have post-exertional malaise. For them, exercise is good. So what do you see the overlap being?
Yeah. Do you want to go, Karen?
We both waiting for each other. I think the overlap is certainly the post-exertional malaise element of that's the defining feature. And I know that originally the publisher wanted us to have long COVID as a leading title in the book, and we said no to that because it's too soon and it's not clearly defined enough for us to have been able to create a book about it. But we couldn't not talk about it. And I think it comes into its own in those acute post-viral stages where you might be trying to identify post-viral fatigue or post-viral fatigue syndrome, where it's going on for a few months. And these like key moments where not to push through, potentially reducing the symptoms or preventing things from deteriorating much worse. I think that's a really important point to get in there. In terms of long COVID itself, I've seen research just shared today about it was exercise helped long COVID group people, and you know all they looked at was fatigue. So you start to question, well, what are you saying is long COVID? Right. Did any of these people have post-exertional malaise? Were they, you know, was it pulmonary rehab? Was it cardiac rehab? It's very vague.
I'm curious. I'm sorry, did you want to say something else, Nikki?
Well, I was just going to say that sort of in the research world, there is a lot of physiotherapists that follow pulmonary rehab and cardiac rehab, and there is, it's really difficult to get the message across that it is important to look for the post-exertional malaise. And if you do have people with post-exertional malaise, the approach must be very, very different. And because long COVID, as Karen said, is such a sort of umbrella term, my worry is that any research that comes out about long COVID and it says exercise is fine because this group of people managed it fine, doesn't show the true picture. And of course we had this with ME as well, didn't we? That it's not just chronic fatigue, it's ME that has got post-exertional malaise, and it's such a history repeating itself. So you know, it is a concern that yes, there is an overlap with long COVID, or appears to be in symptoms, but the important thing is that post-exertional malaise, and we really need to get that message very clear and loud.
I think one of the things that surprised, I guess it hasn't surprised me, but I mean, you know, you mentioned sort of doing the same thing sort of over again. I mean, it just seemed the same researchers who, of course, promulgated the PACE trial and the PACE, you know, the CBT, GET theory of all this have come around with long COVID and said the exact same thing and are doing the exact same studies pretty much that they did before, which were, ridiculous when they did them the first time around for ME CFS, and now they're doing them for long COVID. And I'm just curious, it seems like you said, like, this should be sort of proof of concept. The pandemic should be proof of concept that when you have viral illnesses, there's always a certain group that have long-term sequelae that persist. But the other side, or the other argument seems to be that it's really, a mass hysteria, or it's all this sort of psychosocial strain, and as you suggested earlier, it's anxiety and depression. And I just find it hard to understand why people see this happening all over the world and just think it's, a world global mass hysteria. It seems incredible to think that way, rather than that people who were formerly hardworking people, something's going wrong with their bodies. And they can't work.
Yeah. And we've had a lot of stories from people with ME historically who've said, they've been discharged from a physio because they didn't show up for their next appointment, or they came back and said, I can't manage these exercises. I've been made worse. And people have said they've been called, they're not motivated enough, or they're non-compliant. And it is hard not to get frustrated when, yes, the information isn't at the forefront of our training, but the information does exist. And hopefully with our book, we've tried to distill all this really complex science that's out there and really put it in the context of what a physio needs to know.
Okay.
So it should be easier in future for people to understand.
Okay, we've been talking for about 20 minutes or 25 minutes, so that's about the length I like to keep these. Are there any further thoughts or comments or things you want to let people know before we end our conversation?
I think one of the key messages that we wanted to get across was that this is
oh, you just broke up there for a second, or paused. Okay, now you're back.
So we're just saying that the key message is that this book is not just for physios that work in ME CFS clinics. They're for all physios, because you'll come across people with ME in every single field that we work, and you might not be treating them directly for ME, but you need to consider their ME when you're trying to help them with their musculoskeletal problem or their respiratory problem and so on. And the other thing is that it isn't just for physios, potentially, that all allied health professionals, medics even might find some of it useful as well. I think that was one of the key messages, Karen, wasn't it? Was there another one? I can't remember.
That was the key message, really. And then it was just a thanks to everyone that's helped us and been involved in the production of the book, and just that the last few years as we've been a team, we've learned so much from the likes of the Workwell Foundation in California with all their research, and there's some fantastic professionals out there, and there's a fantastic patient community who we continue to learn from. So this book wouldn't exist without any of those people.
Well, thanks very much. So I will post this soon, and put a link to where the book can be obtained and so on. And thanks very much.
Thank you, David.
Thanks, David.
Okay. Bye.